This conference will now be recorded.
Fantastic. Okay, I'll call this meeting to order. Is there any public comment? I don't think there is, so not. So, everybody got a copy of the minutes. So we need a review and approval for the meeting minutes.
So we won't do the annual minute, right?
Correct.
And
First quarter.
the other ones, in case anybody wants, I'm not reading them.
I have a copy here.
I'll make a motion to approve the February 2025 regular meeting minutes.
I'll second the motion.
All those in favor say aye.
Aye.
Opposed? Okay. So we have claims, Claire?
Yes. So this month's travel claims will be for Dave's travel for $30.80. And we review a budget. We spent $30.80 3 months ago.
Okay, so I just need a motion to pay Dave.
I'll make a motion to approve Dave's travel claim for $30.80.
80, yeah.
Okay. All those in favor say aye.
Aye.
Opposed? Okay. Okay, Blair Treasury Report.
Oh, we have the $1,400 budget and we have $1,060.24 left. The only thing that we have purchased are the membership for National Board of Health and then Dave's travel claims.
Okay. Thank you. Now, you have your report, Blair?
I do, and it's glorious because we have been quite busy around these parks. So we have been focusing on a variety of public health initiatives, outreach efforts, and community-based programs aimed at promoting wellness and supporting our local families. Jenny recently earned her certificate to teach safe sitter courses alongside with Shiloh. They successfully hosted a session with several enthusiastic participants. We had a couple call out sick the day of, so it reduced our numbers, but it was still a fantastic session. It focused on equipping youth ages 8 to 18 with essential skills of CPR, childcare techniques, safe practices for running a babysitting business. And we do plan to continue that safe sitter course throughout the coming year to keep up empowering our community's youth. Darla has made significant progress with expanding our WIC program, Women, Infants, and Children Nutrition Program. I think we're starting to see an increase in participants too, just because of the generalized economy and grocery prices. Through consistent outreach and collaboration with local healthcare providers, our numbers have grown from 60 to over 85 this past year. She continues to focus on strengthening referral pathways and ensuring families are aware and connected to our services. I am quite very proud of that program, to be honest. Additionally, Darla is leading our public health emergency preparedness program, which oversees both emergency planning and communicable disease control. Measles is currently being closely monitored due to the rising outbreaks nationally, and so nearby in Canada, Washington, and then in western North Dakota have a lot of cases of measles. None locally. We continue to offer MMR, measles, mumps, rubella vaccinations, particularly focusing on kids at age 1 and 4, but also there's a select group of adults that are between the birth years of 57 and like 70 that are questionable if they had it, if they didn't, so we've been revaccinating a fair amount of those individuals. If you were born before 1957, you're generally considered immune because you would have been exposed. And those between 58 and 67 are encouraged to consult with getting revaccinated. This reporting period, we successfully had a bike rodeo event last Friday. I don't know if you guys saw or heard about that. We did it up in Summers because it was down here in Shelby last year. We focused on safety and injury prevention. We drew community participation and use of helmets, traffic awareness, and basic bike riding skills. We really focused on helmet safety because that was not a culture of safety really anywhere, so focused on that. In the schools, we have partnered with both school districts to offer puberty education classes to 4th and 5th graders, providing age-appropriate, evidence-based health information to support their development. And let me tell you, that's my favorite thing of all time. I love it. It's fantastic. We continue to monitor and investigate communicable diseases, particularly Hep C and sexually transmitted infections, which are the most prevalent. Shiloh is busy right now doing Tai Chi training, but she's also actively teaching SAIL with our assisted living facility. It's an evidence-based exercise class that meets 3 times a week to aim to improve balance, strength, and overall well-being in adults ages 65 and older. Our plans are to expand this program to other local senior citizen centers with the goal of reducing falls and promoting healthy aging. Lisa's facility is kind of our test run, and I think it's going well. It starts
Let's start on Monday, yeah. But we had a lot of interest.
I love it. I'm super excited. Shiloh is also leading the plan for National Night Out, which is set for August 14th, mental note, which is superhero theme, and this event promises to be a family-friendly event full of fun, food, and opportunities to learn about local services and resources. It is our largest and probably most impactful annual outreach event with community partners, and also probably one of our favorites. We recognize the growing importance of mental health, and Shiloh is working with community partners to identify new initiatives that foster mental health well-being. Ideas currently being explored are public QPR suicide prevention trainings, family game nights, community events, and exercise programs to improve both mental and physical health. The community input is always welcome and encouraged because we don't know what's super impactful without, some feedback. So if you have ideas, shoot them our way. We continue to promote breastfeeding through education, peer support, and direct assistance for new families. Family support remains central to our mission, with staff offering resource navigation and referrals to a wide range of needs. We don't always have the resources in our office, but we know where to tap into them, and I really pride ourselves on knowing kind of what's available for the community. While our outreach and engagement remains strong, program funding is currently unstable. A grant supporting a part-time position, not a nurse position, has ended, leaving a gap that we hope will not have long-term impact on staffing. That's questionable at this time. We're actively exploring new funding opportunities to maintain these services. Looking ahead, we're excited to offer 2 summer exercise programs. One is open to the public in the park, and then the other one is tailored to Lisa's crew in her facility. The efforts, along with many other initiatives, reflect our continued community commitment to improving community health through education, prevention, and strong partnerships. So a little extra side note about the summer exercise program is our office is going to meet twice a week in the park, I think it's Meadowlark Park, and offer things like kickball, basketball, football, just different activities, something for kids to meet and do things group-wise. We're going to do chalk and bubbles and just fun group activities because there is no summer program for kids. So we're hoping to kind of do an activity and then send them to the library for reading after that. So we're excited about that program coming up. Questions, concerns?
Somebody looking into grants to fund that position.
Just us and kind of what's coming through the state. There was a grant, it was called Public Health System Improvement, and originally it was to expand workforce, but now it's kind of aimed more towards maintaining workforce. So luckily we've been able to hold on to that grant, which will kind of bridge some of the gap, because at one point it was excess of funds, and now it'll be just maintaining funds. So we should be able to continue. We're hoping, the wave of public health will shift from prevention is what got canceled, substance abuse prevention, marijuana prevention, things like that, to then just kind of a different program will probably pop up. Kind of what happens is a lot of restructuring. So we're hoping something else will come up.
I was just wondering, because of the rash of the kind of the suicide locally.
Mhm.
I mean,
4 in 3 weeks?
yeah, I don't even want to talk about that, but it seems to be exceptionally high, and I don't know if anybody has looked. Is it bullying? It seems to probably mostly, but it's in the playgrounds and schools. I bet all of the above. I mean, I don't really know, but I would think we should, not that we have to do that, but
I love that you brought this up because I will gladly talk about it. So the current situation that we're in, the suicides range age from 14 to 60s, maybe 70s, I'm not entirely sure. So we have like every population that was hit. So it's hard to ascertain if something was connecting all of them. Because schools were not associated with every one of them, or,
No.
Bullying or online stuff. So that's a little tricky because we've had every age range. There are 2 things that are being worked on right now. Logan Health really sparked up interest in a group that is very, very, very passionate. I attended their meeting yesterday on bringing awareness. And I think that awareness
or looking
group,
for signs of, or even if you are concerned about a person.
yeah.
Where do you go?
It's tricky because where do you start? Where do you start with suicide prevention? Because it's cumbersome. So the group with Logan Health is targeting an event this summer at the fair to just bring community awareness and it to the table, really, to be talked about. And then hopefully what my maybe goal is to keep that group going and moving to help with our mental health advisory board, to keep community involvement with mental health, because it is bigger than that. It's bigger than just a one-time event. It's education to the public, and it's not like, oh, let's host a town hall meeting. No, let's take it to where people are. Let's take it to businesses and offer it to their employees. Let's take it to, groups that are already meeting, to ask the questions, to persuade somebody not to do it, and then to have an appropriate response. So we're looking at ways to bring in QPR training, ask questions, persuade, respond, is that refer, to bring awareness. But then it's things like substance abuse prevention and physical wellness, and just involvement. And then I want to bring in a piece of phones, internet safety. I just watched a really great webinar. Did you get a chance to watch that? It was through my nurse practitioner school, and I sent it to everybody that I know, because it was a national speaker out of Florida who is involved with human trafficking and the problem that we have in the U.S. and how kids are groomed via phones and games. Fortnite, Roblox, Minecraft are grooming young kids, and that's a problem because a lot of kids have, unlimited access to phones. So I would eventually like to bring in that piece as well, because I don't know if we know. As a parent, I was very naive about video games. So it's very large and overreaching, and we're hoping to kind of chip away at the mountain versus just sprinting to the top. So with these 2 groups, I'm really hoping that we can continue that. One project that we're trying to work on is a mental health kit with the sheriff's office. They'll go on a mental health call, and then they just leave them because they don't transport them. The ambulance doesn't, nothing involved, and then they just leave them. And they said it would be nice to leave them with something, like a resource list and something like that. So we're working with trying to bring that on. But it's tricky.
With the school, so we've included Ronnie Waters, the high school counselor. So she's been involved with both the principal and the superintendent. And then we are going to reach. Yep. And
Natalie is already trained in a lot of QPR stuff, so we're trying to get Ronnie up and running in QPR, mental health first aid, things like that. And Natalie is very helpful in that process.
Yeah. She's good with the kids. Yeah, she really is.
And the schools, I
think
are
everybody either. I'm not pretending that that's even possible, but
yeah,
because when things get hidden, you can hide stuff. So
we're going to reach out just to see what funding is available to help us, because we're going to need brochures to hand out that have all of the resources of counselors, pastors, just anybody that you to speak to, and just to get the word out. And our kickoff event will be the Saturday of the fair at the rodeo. And then we're just hoping to keep building from there and doing quarterly events, not just one and done. We want it quarterly, but that information is always available. So if anybody's struggling knows, where they can go to help.
And resources change quickly sometimes.
Right.
And just keeping people involved in the updates, is important, because the more that people know about, the more we can tap into those services. One of them is Many Rivers Mental Health Group services our area. They serviced 14 people last year. And to be honest, I didn't really know about them and that they served us. So that's a problem, right? Like, that's a problem. If I don't know about it, then who else doesn't know about it? So we're trying to bring them on board to our mental health meeting to tell them what they offer and how we can tap into them. So I think it's wonderful that we have this really great group of vested people to help spread the word. Because a lot of times it's just knowing things. Like, I might not be having an issue, but if you're having an issue and you let me know, like, hey, I got all these kinds of resources, let's tap into them. So we're going to hopefully keep that going.
Yeah, it's a big thing in this area right now. I mean, because it's kind of,
All ages,
all
demographics.
and I mean, for the elderly, the gentleman that was his plan. It was well thought out. He had a whole bunch of old cars. He cleaned up this whole place. He set everything in motion. He had everything taken care of. He was afraid he was getting dementia, and I do understand that kind of stuff.
And we also have a problem here too, right? Like, social isolation is very prominent.
Yes, it is.
And like, so we're hoping that some of these community activities, family game nights, or, just anything and all the things to get out and about. And so, we're trying.
I think your event too, the summer event with bringing kids together, to play games is going to be very
Well, it gets them away from their isolation.
It does. It introduces to kids that, there's kids that may not be in your grade perhaps, or that are not in your little social circle, that, or just, include everyone.
Enlarges your social circle.
Yeah.
Is anything being done to reach out to homeschool kids?
So we don't do any targeted outreach, no. We send out newsletters to places that have newsletters. We do our Facebook group. We do word of mouth, posters, flyers, things like that. There's a lot of very active social media groups, and I think that using those avenues, it gets shared a lot, and it just is very talked about. So I think if you miss it, you are not very socially inclined, maybe in general, because we do put it out there. What I think is pretty decent, but if you have other ideas, we're happy to explore them.
Another topic is fentanyl activity changing in the community. Is it increasing? Or are you hearing cases of?
I can't really speak on that. Darla and Shiloh would be a little bit extra helpful to speak on that. I know that there's constantly seizures, or, like they seize drugs and they're always around. But are we seeing a problem directly associated with it? I'm naive about that and I don't know.
The seizures, is that, we don't know if that's pass-through stuff or if it's stuff that was targeted for this area.
Yeah, and it's hard because the interstate, the port, we're a lifeline to the rest of the country, and I don't have the answer to that. There's constantly drug people booked in jail, but where are they going with it? I have no idea.
Well, we're Highway 2 and the interstate. So
And the train,
you get the west, you get north and south, east and west, traffic like that.
And we're not very far off the reservation, and Indian reservations are highly targeted.
Yeah, and it's a bummer that our prevention grant is going away, because that specifically is for youth and drug prevention, not tobacco prevention, because that has a different grant. But that kind of stuff is good. And like I would like to believe that when we do these community outreach events, somebody's always talking about it, you know, like, I know when I was golfing, like, I asked my group of kids, like, you guys happen to vape? Like, what do you know about vape? You know, like, we're always just kind of throwing things out there that this summer group activity, hopefully we throw that out there too, like, you know, you can't play kickball and be a vapor because your lungs are going to fall apart. So we're, you know, constantly talking to kids about it, but, you know, it's tricky with the high movement of drugs. Yeah, great questions, guys. So Ron is not here, obviously, but he did send his report, so I'll read through that real quick. It's a fairly short report. So he's making substantial progress on 2025 inspections of licensed establishments. He completed a relicensure or a new license of the following establishments: Whistle Stop Bakery added a wholesale license, Matador Steakhouse, Up North Meats, and the Sunburst Mint Bar. He continues with plan reviews for the following new establishments, and a couple of them have been challenging: Oasis Bar, Prairie Peddler Coffee Shop, and a new shop in the old Prairie Peddler location. In addition to used apparel, plans to serve soft serve ice cream, rotisserie hot dogs, cotton candy, snow cones, and a variety of other minimal risk frozen items prepared in their shop. The Shelby Theater is ready to license when it's up and running. He has a call into Shannon to discuss coordination with vendor approval for the fair. The Early Bird and Sunburst and Happy Steer mobile and Shelby location are now out of business. He's not sure about the oil barn, which was a Sapphire oil processing plant near Galata, as they've not responded to delinquent notices. He still has a couple of septic systems installations pending. And the DPHHS Environmental Health and Food Safety is getting ready to launch a new online inspection form and cloud-based in September. Many of us are a little apprehensive about the centralized control, potential glitches, and extra time that it might be involved, among other issues. So that is Ron's report. And I do know that there was legislation going on about the septic system installations, that hopefully they have streamlined that to make it a little bit faster for new septic systems, which then leads to maybe increase in quick turnaround of building houses and living facilities. So hopefully that helps things move along. That is Ron's report.
So is it that Up North Meats is fully licensed now?
Yes, they're either a new license or a relicense. Yep. Mm-hmm. That is Ron's report.
Thank you, Blair. Does anybody else have any other business?
So our next meeting is set for August 12th. I am away at a Great Beginnings, Great Families WIC kind of conference in Helena for the week. And I was wondering if we could maybe move it to the 19th of August. That conflicts with anything. I'm hoping that it's far enough away that we, can plan it.
I don't think it matters.
Awesome. Then we'll schedule for the 19th at 9 a.m. Still here, all that good stuff. Fantastic.
Okay, well, we'll have our next meeting August 19th. That sounds okay to me right now. I don't know, school's probably starting sometime there.
I think it's the week after. Yeah, the Wednesday after.
Okay.
I paid attention to that too.
Does anybody else have any other business they want to bring up? Okay. I have a motion to adjourn the meeting.
Move to adjourn the meeting.
Second. All in favor, say aye. Aye. Both. All right, guys. We're good to go.
Thank you. Bye, Dr.